Hello, I'm Andrew Gabriel, and today I'm going to talk to you about prostate cancer, and particular prostate cancer awareness. And this is what you need to know to look after your health or the health of a man in your life. So I am a prostate cancer patient myself. I actually run several prostate cancer support groups, and I do one-to-one support for patients. I give presentations to patients and also to clinicians from a patient's perspective. However, I am a patient and I'm not a clinician myself. So let's start with, what is the prostate? Well, the prostate's a male sex organ. It's situated right in the middle of your abdomen, just below your bladder. Your urethra, which is your pee pipe, goes through the middle of the prostate. And the prostate contributes about 40% of your semen volume, mainly a chemical called prostate-specific antigen, or PSA, and we'll come on to PSA later. So your prostate is required for procreation. What's prostate cancer? Well, prostate cancer is when some of the cells in your prostate start growing uncontrollably. And initially this happens in the prostate, but when this happens, the cells can start proliferating outside the prostate and can start growing other areas of your body. And that's a really serious condition, and it can be fatal. So ideally, you want to stop this from happening. Now, this is what I'm going to talk about. So prostate cancer is the most commonly diagnosed cancer in the UK, with around about 50,000 cases a year. Unfortunately, this leads on to nearly 12,000 deaths per year. That's one death every 45 minutes. 1 in 8 men in the UK will be diagnosed with significant prostate cancer at some point in their lives. Unfortunately, if you're a Black African or Black Caribbean man, that figure rises to 1 in 4 men will be diagnosed with prostate cancer that's significant at some point in their lives. There are a few other things that raise your risk of prostate cancer. So if your father or a brother had prostate cancer, your risk is raised by 2.5 times. And if your mother or a sister had breast cancer below the age of 60, your risk is also increased. But the main factor that is the risk factor for prostate cancer is actually your age. So as you get older, your risk of prostate cancer increases. And this starts to become significant at about age 50. However, if you had any of the higher risk factors, so you're a Black man or father or brother with prostate cancer or mother or sister with breast cancer, then the risk starts to increase at a younger age. So you need to bear that in mind, possibly from about age 40 or age 45. So what are the symptoms of prostate cancer? Well, the most common symptom of prostate cancer is nothing. That makes it quite hard to find. So prostate cancer in the early stages usually doesn't cause symptoms, and even in later stages often doesn't cause any symptoms. But there are some symptoms that you should be aware of, because these could be an indication of prostate cancer. So just to run through these quickly, if you notice your flow rate when you're peeing has slowed down, if you notice you're peeing more frequently, particularly more than once at night, if you find it difficult to start peeing or it takes you a long time to stop peeing at the end, urgency, so that's where you get a sudden need to pee and you can't hold on. If you see any blood in your urine or semen, if you lose your semen, or you notice a reduction in the strength of your erections, these are all things that could be prostate cancer and so need to be investigated. But let me reiterate, most people diagnosed with prostate cancer don't have any symptoms. And in fact, most people with any of these symptoms I've listed have other conditions, not prostate cancer. But it is a risk for prostate cancer, so you should go and get checked out. And even if it's not prostate cancer, most of those symptoms are actually easily resolvable. So it's worth going to get checked out anyway. So I've talked about getting checked out. Now, early diagnosis tends to be more curable with fewer ongoing side effects, whereas if you're diagnosed later, then you can end up with more long-term side effects as a result of treatment, and it can even be a fatal disease. So there's no screening program in the UK. It's very much up to you to go along to your doctor and to ask to be checked out. Now, we talked about PSA at the beginning. That's the chemical the prostate makes. So there's a simple blood test, which is to measure how much PSA leaks into your blood, because PSA isn't really intended to get into your blood. But if you've got prostate cancer cells, that is one route by which PSA can leak into your blood. There are other causes. So the PSA test, which measures the level of PSA in your blood, is not a test for prostate cancer. It's a test which can give an indication that further testing is required. So ask your doctor for a PSA test. And in the UK, you can do that from age 50. But if you have any of the additional risk factors I mentioned, you're a black man, brother or father with prostate cancer, or mother or sister with breast cancer, then you need to ask for that at an earlier age, from age 40 or 45. It's also important that you get tested if you've got no symptoms. Remember, I said the most common symptom of prostate cancer is nothing. That's the point where you want to catch it. So that's a point where you need to have a PSA test in order to check that your PSA level is okay. You might get talked out of that by your doctor, but do push back and say, no, I want to have a PSA test even though I don't have any symptoms. That's really quite important. Now, PSA increases gradually with age anyway. So if you have multiple PSA tests over a period of time, you'll see your PSA gradually creeps up. But actually, a good indication of something that needs sorting out or further investigation is if your PSA suddenly starts increasing more rapidly. That's actually more useful than the individual PSA readings. So you should try and have PSA tests periodically so that you can graph your PSA. Unfortunately, about 15% of prostate cancer doesn't increase PSA at all. So you may need to ask for another test from your doctor, or the doctor may offer it, and that's called a digital rectal exam. So that's where the doctor will feel the surface of your prostate through your back passage, and the doctor can tell by how soft or by how hard or lumpy the prostate is whether there's any cause for concern that needs some further investigation. And if any of these things throw up any questionable results, you'll be referred to the urology department at hospital, who will do further investigations to decide whether or not you need any treatment, and then go ahead and you would start treatment if you do, or be discharged if you don't. Now, there is a small risk of overdiagnosis and overtreatment. And a lot of doctors refer to this because this was actually quite a big issue 10 to 15 years ago. It's a much smaller issue now. And due to changes in the diagnostic pathway and the changes the way prostate cancer is treated, the incidence of overdiagnosis and overtreatment are very small. But as someone who had prostate cancer myself, I would say you definitely want to go and get checked out and not leave it, because you can end up with prostate cancer that's incurable if that happens. So just to give you some more links where you can go and find out some more information. Prostate Cancer UK is one of the main charities in the UK that's involved with prostate cancer and provide a lot of information for people concerned about prostate cancer or who have actually been diagnosed with prostate cancer. There's an enormous amount of information available for them. And they have a set of specialist nurses who you can call up and talk with. So if you search for Prostate Cancer UK, you'll find that information. And if you live in Wales, Prostate Cymru is an organisation in Wales that also supports prostate cancer patients and those concerned about prostate cancer. So thank you for listening, and do go off and get yourself a PSA check, or ensure that the man in your life goes and gets a PSA check.